Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, Joel Bolling, the Assistant Dean for Inclusion, Diversity, Anti-Racism, and Equity at the Johns Hopkins Bloomberg School of Public Health, joins the podcast to talk about Juneteenth. Let's listen. Joel Bolling, thanks so much for joining us on Public Health on Call. Let's start off by talking a little bit about your work here at the School of Public Health.
Great, and thanks for having me. So the School of Public Health back in 2020 started this inaugural role that is the role that I'm in as Assistant Dean for Inclusion, Diversity, Anti-Racism, and Equity. I started back in January 2020, and if you recall, this little thing that happened coming out of January 2020 in early parts, really starting in March, this little thing called COVID happened. And then as we were grappling with the pandemic that is COVID, we were faced yet again with the deaths of, in this case, George Floyd, Breonna Taylor, and so many others, and reminding our community that the ongoing pandemic and endemic, really, of racism still exists and still impacts our community. And so the work that wasn't part of an inaugural role really expanded very quickly to help our school further address some of the challenges that we were facing around, again, inclusion, diversity, what we talked about in terms of racism and equity. So our office was formed back in 2021, really with a focus on advocacy, being an internal consultants to help us strategize and partner, do trainings, workshops, offer educational materials, support student accommodations, retain, recruit, support faculty, staff, and students, really with a lens on building a community that fosters a sense of belonging. And of course, as part of that, we help steward our IDARE action plan that is part of how we guide our work throughout the School of Public Health to address so many issues.
And I remember during that time you being such a source of support and a wealth of knowledge. And today we are going to talk actually about June 19th, which is a federal holiday, which became a federal holiday during your tenure here at the Bloomberg School. So can you talk a little bit about the history of this observation first?
Yeah, absolutely. And I'm so excited to talk about it as this holiday's approaching. That, Juneteenth, as it's called around the country, its very basics celebrates when enslaved Black Americans in Galveston Bay, Texas, learned that they were actually legally free on June 19th, 1863. But it's just so much more than that historical component. The focus of this holiday really is about understanding the legacy of what it meant to our country and to marginalized peoples, and in this case, Black Americans, to have that legacy of enslavement. And so, I like to talk about Juneteenth with giving some historical context for the holiday. So keep in mind that even though in the United States, and at the time in pre-United States in our colonies that led to the United States, there had been a long history of enslavement. So when slavery officially ended, so that technically was around 1863, even though some might argue things didn't really resolve until the end of the Civil War and 13th Amendment and those components. But if we look at what some historians account as some of the first enslaved people being brought to North America, specifically to the colonies, that was back in 1619. So that means that there was approximately 246 years of slavery. So to put that into context, I was thinking about this for our conversation today. I was wondering, well, how many greats is that in terms of generations of a family? And so I think about my own family that my grandmother passed away just before I started here at the School of Public Health back in December 2019 at almost 101 years old. Had the great and unusual privilege of being a great-great-grandparent at the time when she passed away, which is unusual today. And again, she was almost 101, so that is unusual. Back in the 1800s, the average lifespan of the enslaved Black American was around 22 years. So, basically my grandmother in 2019 had lived almost 5 times the lifespan of one of her enslaved ancestors. And so what that means is that back when Juneteenth occurred, back on June 19th, 1863, the people who learned of their freedom that day could have been, and many perhaps were, the descendants of those original enslaved folks who were brought. And so that person who learned it that day would have been the great, 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 great grandchild of some of those original enslaved people. And so I just put that in perspective because that's roughly 11 generations of Black Americans who experienced slavery throughout their lifetimes. And so I share that because it's such a monumental and fundamental shift in American history that happened on June 19th. And so the fact that it took us an additional 150 or so years to finally recognize the impact of what started in 1619 is pretty phenomenal. So I think that's so critically important.
There's been a lot of conversation about how to observe the day. It formally became a federal holiday in 2021, which, as you're saying, is long overdue. Even though you have generations in between, we're not that far out from this. And so there's questions about, is it a day of celebration? Is it a day of reflection? Maybe a little bit of both. Where are we now?
So let me start just in general with the day of celebration. And I think this is such an important piece that I think about the work we do in public health that is often so heavy and so challenging when we're thinking about addressing health equity issues that exist, the disparities that communities experience. We don't often have those opportunities. So Juneteenth as something that marks the end of such a terrible time in our history, to mark that as a celebration, I think is a powerful lesson. So people today spend time celebrating. They spend time in community. They spend time with family. They spend time hosting programs that help us remember our history. They spend time volunteering to say, hey, we are so grateful for where we are right now, but there's still so much work to be done. And frankly, we spend time resting. There's been a lot of conversation, even here at the School of Public Health. We've hosted historically some Juneteenth programs, as you might imagine, over the years. And many times our speakers who come and talk about the power and importance of rest, something that is particularly poignant as it was something that our ancestors could not do. And so for me, this Juneteenth celebration and how we commemorate it today is really empowering to think about, again, that celebration that focuses on the things that are most important in so many people's lives: family, community, freedom, and the strength of the human spirit. So many lessons that we learn and built up into what seems at the surface level as just another day off.
So we've got celebration. We're acknowledging we've at least moved a step forward in some ways. We've got rest in there, which is, I know, incredibly important. Rest is a radical act. We've heard other speakers talk about that. Let's talk a little bit about collective responsibility and maybe some reflection.
Yeah. So I think about, again, there's so many lessons that we can learn from Juneteenth, or that Juneteenth reminds us of. Couple of pieces related to that. So one, the importance of coalition building. So as someone who identifies as African American, my ancestors were some of those enslaved people whose generations being seen as property, as being seen as less than human, being seen legally as something below others in our society, that I also recognize in the understanding the resilience of my ancestors' experiences, that my ancestors gained their freedom not only through their own efforts, but through the efforts of others who also were in coalition with them. And so for me, Juneteenth is also about thinking about coalition building. How, when there's such terrible atrocities happening, when there are such terrible conditions impacting communities, how do we build out from more than just ourselves, more than just our immediate communities, to gather a set of allies, a set of supporters who are willing to be advocates and voices and take action to help make change happen and lasting change happen. So coalition certainly is a key part. The other part is there is power in being in community when the struggle is hard. And I think as in the field of public health, I think so many public health practitioners, researchers, just public health professionals learned that lesson very vividly during COVID, that the world was dying. So many people were dying and being impacted in various ways. And the work was extremely hard, extremely difficult. And public health work has always been extremely hard and extremely difficult. But how do you keep going in that work? And some of the way in which you do that is finding your community, building those connections, building those bridges. So we talked about coalition building outside of a community, but also making sure that you have a strong internal community as well, to make sure that you're being supported by those who are most familiar with the type of struggles that you're experiencing, but also can provide that encouragement and reaffirmation that the work that you're doing is meaningful work, is valuable work, is life-changing work, is life-saving work. So I think those are two important pieces.
So we've got rest, celebration, reflection. There's one other theme that I've seen floating around, and that's recommitment. And I want to talk about that from the public health perspective. I mean, we've come a long way from a life expectancy of 22 years, which is really, really shocking, that number, to wrap your head around. We've come a long way, but there's still work to be done, especially in public health. So let's talk about maybe where you see some opportunities for that.
Yeah, and let me just also note that 22 years were for enslaved Black Americans. As we talk contemporarily about health disparities and life expectancy differences between different communities, I just want to acknowledge that 22 years was for Black enslaved Americans. White Americans at the time who were not enslaved had a life expectancy of around 43 years, a significant difference. And we still see, obviously those sorts of disparities today. But to your question, I think some of the ways that we can engage and apply, again, some of those lessons from Juneteenth is thinking about, as we try to address things that are systemic issues, that we have to think about how we change systems. Changing systems, I think, is often derailed by individuals who are saying, hey, well, there are laws that prevent us from doing this. There are policies that prevent us from doing this. There are historical practices that prevent us from doing, whatever the change, the health intervention may be. But what I would say to that, and I think is an important lesson from Juneteenth, is that the thing that may be right is not determined by what current laws are, what the current policies are, what the current practices are. And so having some level of discernment to understand and figure out strategies to help others understand and move forward, being on the right side of history, we'll put it that way. So if someone says to a public health professional, we can't change the way we've been doing something because the law is the way it is, then work to change the law. If it's a policy, work to change the policy. If there are historical practices, work to change the practices. And that's in either side. So if the law doesn't exist, create a law. If the law currently exists, you may work to get rid of it or change it. I think public health is uniquely positioned to understand that and does that on a day-to-day basis. I think about the work that happens around changing laws related to gun violence and working towards gun violence prevention or substance use, pieces like that public health can work towards understanding and implementing. Now, what I would say is that we are often focused on the external. So what is happening out of the community of public health? Where we also need to double down in our work is looking at how these oppressive systems, how marginalization, how the histories of our legacies, including the legacy of enslavement and so much other challenging history that we have experienced in our society, play out in the actual day-to-day lives of people who are trying to be in the field of public health. And so we know that there are communities that are still woefully underrepresented in the field of public health. We know even as a field of public health, that field is not always well respected. I think it's a lot more respected now in the last 4 years, obviously, but not seen as much as an integrated part of what it means to have a healthy society. But we absolutely need to foster that. And so we have to do some internal work to help advance health equity. We also have to advance inclusion, diversity, anti-racism, and equity within our own field.
Representation is certainly a huge issue, a dearth of data, all of those. This sounds like a great opportunity for coalition building.
Yes, absolutely. And at the core of advancing, I think, health equity, and at the core of advancing inclusion, diversity, anti-racism, and equity, and again, an important lesson from Juneteenth is that this work moves forward at least 3 levels. The personal level: how do we understand our own biases? How do we understand our own ways in which we are impacting the world around us? And how can we change that if necessary? The interpersonal level: how do we interact with others and others interact with us? And how do we change those interactions when necessary to improve the quality of wellness and health for individuals? And the systemic level, how do we exist in our society, in systems on all levels? And what can we do to address those systems? If you only address one of those 3, the whole process does not work. You have to address it at all 3 levels to really get not only change to happen, but lasting change to happen.
Is there anything else you'd like to add?
Yeah, absolutely. As we face as a nation and arguably around the world, the polarization around diversity, equity, inclusion efforts, I think Juneteenth is a beautiful moment for us to pause and reflect on really what the value of diversity, equity, and inclusion really means in health equity work, in really social justice work, things that help move us forward collectively as a society, as a world.
We really appreciate your time and your insights on this. I think one thing that people could do is listen to this podcast for Juneteenth.
Absolutely.
Well, thank you so much for joining us, and we really appreciate, again, your time and your insights.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.